Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Small Intestine Disorders. Introduction. Your small intestine is the longest part of your digestive system. It connects your stomach to your large intestine and does most of the digesting of the foods you eat. There are many disorders that can affect the small intestines. Treatment of disorders of the small intestine depends on the cause. It may include medicines, surgery, or other therapies. This program explains common small intestine disorders. It covers symptoms of small intestine disorders as well as treatment options. The digestive tract. The digestive tract is made up of organs through which solid and liquid foods pass. The small intestine is part of the digestive tract. Swallowed food goes through the esophagus, which is the feeding tube. Next, food passes through the stomach, where it is partially digested. Digested food goes from the stomach to the small intestines, where most nutrients are further digested and absorbed into the body. Fibers and digested food finally reach the colon. In the colon, the rest of the nutrients get absorbed and stools are formed. The walls of the intestines have 3 layers. The inside layer is called mucosa. It contains many folds that are covered with tiny, finger-like growths called villi. The villi allow the small intestine to absorb nutrients. The middle layer is muscle that helps push food through the intestines. The outer layer of the intestines is called serosa. The serosa is smooth so the intestines do not get stuck together in the abdominal cavity. Symptoms. Many small intestine disorders have similar symptoms. The main symptom is a change in stools, such as chronic diarrhea or constipation. Other common symptoms of small intestine disorders are impaired growth and development, pale, foul-smelling, or fatty stools, stomach bloating and pain, vomiting, weight loss. Some small intestine disorders may also cause bone or joint pain, depression or anxiety, extreme tiredness, inability to pass gas, tingling numbness in the hands and feet. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Celiac disease. Celiac disease is a digestive disease in which eating gluten damages the small intestine. Gluten is a protein in wheat, rye, and barley. Gluten is found mainly in foods but may also be in other products. Other products that may contain gluten are glue on stamps and envelopes, lip balms, medicines, vitamins. Celiac disease is an immune disease. The immune system is your body's defense system. It keeps you healthy by fighting against things that can make you sick, such as bacteria and viruses. With celiac disease, the body's immune system reacts to gluten and attacks the lining of the small intestine. The villi become damaged. The body cannot get the nutrients it needs. Celiac disease is genetic, which means it runs in families. Sometimes the disease is triggered or becomes active for the first time after childbirth, pregnancy, severe emotional stress, surgery, viral infection. The only treatment for celiac disease is a gluten-free diet. If you avoid gluten, your small intestine will heal. If you eat gluten or use items that contain gluten, celiac disease will continue to harm your small intestine. Your healthcare provider may refer you to a dietitian to help you create a well-balanced meal plan. A dietitian is a healthcare professional who specializes in food and nutrition. Crohn's disease. Crohn's disease is a type of inflammatory bowel disease, or IBD. It causes inflammation in the intestines. Crohn's disease can affect any part of the gastrointestinal system from the mouth to the anus, including the small intestine. It usually only affects the colon and the last part of the small intestine, called the ileum. Inflammation caused by Crohn's disease can also cause sores that tunnel through the affected area into surrounding tissues, such as the bladder, vagina, or skin. These tunnels, called fistulae, often become infected. Crohn's disease usually causes nutritional problems. This can involve a lack of protein, calories, or vitamins. Other problems associated with Crohn's disease include arthritis, skin problems such as rashes and sores, inflammation in the eyes or mouth, kidney stones or gallstones, liver diseases. There are no known causes of Crohn's disease. Scientists believe that the immune system of the body responds to a virus or bacteria, causing the intestinal walls to become inflamed. Treatment for Crohn's disease may include medication, nutrition supplements, surgery. Treatment can help control Crohn's disease, but there is no cure. Medicines may be used to reduce inflammation and block the immune system reaction causing the inflammation in the intestines. Some medicines can also treat nutritional deficiencies. Surgery to remove part of the intestine can help Crohn's disease but cannot cure it. Many Crohn's disease patients need surgery either to relieve symptoms or to correct complications such as blockage or bleeding in the intestine. Patients with Crohn's disease may need medical care for a long time. They will need regular checkups with a healthcare provider to monitor their condition. Intestinal cancer. This section discusses cancer of the small intestines, not cancer of the colon. Intestinal cancer starts in the cells of the small intestine. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them by replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancerous, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the small intestine will always be called intestinal cancer. This is true even if it is spread to other places in the body. Even though intestinal cancers are rare, eating a high-fat diet or having certain digestive problems can raise a person's risk. These problems include a history of colonic polyps, celiac disease, Crohn's disease, FAP. Most people receive more than one type of treatment for intestinal cancer. Treatment may involve surgery, chemotherapy, radiation therapy. Other disorders. There are many other disorders that can affect the small intestine. Some of these include intestinal obstruction, peptic ulcers. An intestinal obstruction happens when food or stool cannot move through the intestines. The obstruction can be complete or partial. There are many causes of an intestinal obstruction. The most common causes are adhesions, cancers, certain medicines, hernias. A complete intestinal obstruction is a medical emergency. It often requires surgery. A peptic ulcer is a sore in the lining of your stomach or your duodenum, the first part of your small intestine. Peptic ulcers happen when the acids that help you digest food damage the walls of the stomach or duodenum. The most common cause is infection with a bacterium called Helicobacter pylori. Another cause of peptic ulcers is the long-term use of NSAIDs, such as aspirin and ibuprofen. Stress and spicy foods do not cause ulcers, but can make them worse. Peptic ulcers will get worse if not treated. Treatment may include medicines or surgery.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Your small intestine is the longest part of your digestive system. It does most of the digesting of the foods you eat. There are many disorders that can affect the small intestines, including celiac disease, Crohn's disease, intestinal cancer, intestinal obstruction, peptic ulcers. Many small intestine disorders have similar symptoms. The main symptom is a change in stools, such as chronic diarrhea or constipation. Other common symptoms of small intestine disorders are stomach bloating and pain, vomiting, weight loss. Talk to your healthcare provider if you think you may have a small intestine disorder. Treatment of disorders of the small intestine depends on the cause. It may include medicines, surgery, or other therapies. Thank you for using Explain.